This video capsule explains how to perform the immunochemical fecal-occult blood test, commonly known as the FIT test. If you have bleeding hemorrhoids or if you are a woman and have your period, you must wait until the bleeding has stopped to perform the test. Note that no special diet is necessary before taking the test. To obtain the collection kit, you must receive a prescription either in person or through a virtual consultation from a family doctor or nurse practitioner. If you do not have a family doctor, you can see a doctor at a walk-in clinic. With this prescription, you'll be able to obtain the kit at a blood testing center near you. Colorectal cancer often leaves traces of blood in the stools that are invisible to the naked eye. In order to check whether or not you have blood in your stools, you can take the FIT test. This result will not confirm whether you have cancer or not, but it will let you know if you need to take another exam to verify the results. The FIT test consists of you collecting a stool sample at home, which will then be analyzed in the laboratory. You now have your kit in your hands. It contains a tube-shaped container closed with a stopper, a plastic bag, and an instruction pamphlet. You may also have received a waterproof, biodegradable paper to perform the test. If not, simply use a clean plastic container or an aluminum pie plate. Here are the steps to take to collect your stool sample. For your test results to be accurate, it is important that you complete each of the following steps. 1. Open your collection kit. 2. When you are ready to take the test, take the tube and clearly write on the label your first name, last name, date of birth, as well as the date and time of the sample. 3. Unfold the waterproof paper. Place it directly over clean water in the center of the toilet bowl so that the sides of the paper stick to the sides of the bowl. If you are using a plastic container or aluminum plate, throw it away after collection. 4. Pass your stool on the paper or in the container. The stool should not be mixed with urine or any other liquid before collection. 5. Twist and pull the stopper to open the collection tube. 6. Lightly scrape the surface of the stool with the rod attached to the tube stopper before the paper sinks into the water. Scrape only a small amount of the stool, enough to cover the tip of the rod. Leave the paper in the bowl. 7. Put the rod back into the tube and close it tightly. Do not open the tube again once you have closed it. 8. You can now flush the toilet and wash your hands. 9. Place your collection tube in the plastic bag and seal the bag. 10. Keep the bag in the refrigerator until you bring your stool sample to the collection center. You must bring your stool sample to the collection center where you obtained your kit as soon as possible, no later than 48 hours after collection. If you still have the prescription your doctor gave you for the test, remember to put it in the bag with your sample. Your test results will be sent to the doctor who prescribed the test for you. They will contact you with the results. For more information on colorectal cancer and the advantages and disadvantages of IFOBT screening, visit the Government of Quebec's website.